day, everyone. Today's lecture will be on conscious sedation in dentistry. This lecture will cover the meaning of conscious sedation. We will discuss about the significant problem in conscious sedation methods. We will look at the indication and contraindication of conscious sedation. We will explain the meaning of dissociative anesthesia, and we will discuss on the drugs used in conscious sedation procedure. So sedation and general anesthesia are forms of anesthesia. General anesthesia is an induced, reversible and controlled loss of consciousness. The patient has complete loss of consciousness. Sedation, which is a component of general anesthesia, is the depression of awareness whereby a patient response to external stimuli becomes limited. Sedation may be minimal, moderate or deep. Sedation is a sequence of levels ranging from minimally impaired consciousness to unconsciousness. The following terminology refers to the different levels of sedation: minimum, moderate, dissociative, deep, and general anesthesia. Levels of sedation are in a sequence because a sedated patient can go in and out of an intended level quite rapidly. Minimal sedation or anxiolysis is a drug-induced state during which the patients can respond normally to verbal commands. Moderate sedation is also known as conscious sedation, is a drug-induced depressed consciousness. It needs for purposeful response to verbal or tactile stimulation. There is no interventions needed to maintain a patient airway. Adequate spontaneous ventilation is required for moderate sedation, and in conscious sedation, the cardiovascular function is maintained. Dissociative sedation is a cataleptic state that occurs with both analgesia and amnesia while maintaining protective airway reflexes, spontaneous respiration, and cardiopulmonary stability. Deep sedation is considered as a drug-induced depression of consciousness, during which patients cannot be easily awakened but respond purposefully to repeated painful stimulation. Patient would require assistance to maintain a pattern airway, and spontaneous ventilation may be inadequate. So conscious sedation is a technique in which the use of a drug or drugs produces a state of depression of the central nervous system, enabling treatment to be carried out, but during which verbal contact with the patient is maintained throughout the period of sedation. Conscious sedation retains the patient's ability to maintain a pattern airway independently and continuously. There is no intervention required to maintain a pattern airway, and spontaneous ventilation is adequate. In conscious sedation, cardiovascular function is usually maintained. What is the goal of conscious sedation? First, to provide a safe analgesia, anxiolysis, sedation, and amnesia during the procedure. Second, to safely decrease adverse responses psychologically associated with the procedures. Third, to enable the patient to return to their pre-procedural level of functioning. Fourth, to facilitate provision of quality care. The fifth goal is to minimize the extremes of disruptive behavior. The other goal is to promote a positive psychological response to treatment. And the last objective of conscious sedation is to allow returning the child to a physiological state in which safe discharge is possible. So what is the prerequisite for conscious sedation? Conscious sedation requires a careful pre-sedation evaluation. It is important to have a good understanding about the pharmacodynamics and pharmacokinetics of the drugs. The airway management equipment, the venous access equipment, and the appropriate intraoperative monitoring device should be available in the clinic. And course, we need a well-trained staff. This staff should be trained in the basic life support manual. Pre-operative examination or assessment will include blood pressure monitoring, pulse recording, oxygen saturation recording, the monitoring of the respiratory rate, the patient's appearance and skin color monitoring, and also monitoring the level of alertness of the patient. So conscious sedation is indicated in a number of cases. One, in dental phobia and anxiety. It is also indicated when long traumatic dental procedure is advocated. Conscious sedation is also indicated when there is situation where medical condition can be aggravated by stress. For example, in the case of angina, asthma, and epilepsy. Conscious sedation is also indicated in children more than 1 year of age, in mentally challenged individuals, and also indicated when there is ineffective local anesthesia due to aneurysm. So conscious sedation can be administered via oral, intramuscular, intravenous, or inhalational route. So let us look at oral sedation. Oral sedation is the most common route of administration for light sedation in dental procedures. They mainly help in anesthetic failure and anxiety reduction and are cost effective and needs minimal monitoring. However, although most adults readily accept oral medication, pediatric or cognitively impaired patients may not willingly accept it. And severe adverse reaction are relatively less through the oral route, and the bioavailability of the oral sedative is increased by 27% when given sublingually compared to same dose given. The disadvantage of oral sedation, there is inability to titrate drug dose to a desired clinical endpoint. There is a predetermined dose which need to be administered with that need to be administered with a risk of prolongation that is too light or too deep. The other disadvantage is that the post-operative action will be prolonged. Thereby, the individual should not leave the office unaccompanied. The commonly used drug for oral sedation include zaleplon, trizolam, and lorazepam. The second conscious sedation technique is intramuscular sedation. Intramuscular administration is a parenteral technique in which the drug enters the cardiovascular system directly without passing through the gastrointestinal tract. Parenteral techniques are advantageous over enteral techniques since the drug does not have to enter the enterohepatic circulation before entering the systemic circulation. However, it is important to remember that intramuscular administration is a less preferred method of administration than other parenteral application of inhalation and intravenous method in dentistry. So what are the advantages of intramuscular administration? The rapid onset of the drug, which takes about 15 minutes. The faster, the highest clinical effect, which is about 30 minutes. And intramuscular administration also has reliable absorption of the drug compared to enteral administration. The disadvantage of intramuscular administration include there is a latent time of 10 minutes that does not allow titration. And the effect of the drug cannot be reversed rapidly when various complications develop. The other disadvantage is that not all patients are willing to be injected, and the drug that usually being used has a long duration of action, which is about 2 to 4 hours or more, and it is also important to remember that injuries may occur during the intramuscular injection. So intramuscular method is not recommended for conscious sedation in pediatric patients. The third conscious sedation technique is what we call inhalational sedation. Inhalation is the root of sedation where the gas or volatile sedative agent reaches the alveoli in the lungs and shows its primary effect by absorption via blood gas. The agent that reaches the alveoli reaches the tissues through the arteries, arterioles, and capillaries by mixing into the blood from the alveoli and shows its effect in the central nervous system. Inhalation sedation technique is the safest technique that used most frequently in children. Many volatile agents has been used such as nitrous oxide, isoflurane, sevoflurane, and desflurane. Inhalation agents other than nitrous oxide are generally used in deep sedation and general anesthesia. So the most commonly used sedation in dentistry is nitrous oxide inhalation sedation, which can be used alone or in combination with other sedatives. So the technique of choice, inhalation sedation is the technique of choice for light conscious sedation and mostly used is nitrous oxide technique. The ratio of nitrogen and oxygen should never go beyond 50-50. The advantage of an inhalation sedation technique is it has a rapid onset of action and recovery. The disadvantage, initial equipment cost is expensive. We need to buy a nitrous oxide delivery machine, which is quite expensive. And there is a need to have an effective scavenging system. And inhalation sedation can be hazardous to dentists as well if they are exposed for a very long time. Long-term use can be hazardous. So inhalation sedation is contraindicated in COPD, in severely emotional disturbance, and also in early pregnancy. So inhalation sedation, for example, for nitrous oxide, nitrous oxide sedation is indicated in a number of cases. First, psychosocial indication. There is indication relating to anxieties regarding to dental treatment, which include phobias, which include phobia, specific anxiety to the drills, to the needle, and to the procedures of, for example, extraction. General anxiety, for example, when things are put inside the mouth, or anxieties to all dental procedures. Indicated for gagging cases, where patient cannot tolerate object being put inside the mouth without retching. Also indicated when there is persistent fainting during procedures. Especially when during the administration of local analgesia. And nitrous oxide also is indicated for idiosyncrasy to local analgesic. This is where patients who have problem where local analgesic appear not to work and the cause of the failure is psychological rather than. Nitrous oxide is also indicated for certain medical condition. We have to remember that some condition may be aggravated by the stress of undergoing dental treatment. Such medical condition, for example, ischemic heart disease, hypertension, asthma, epilepsy, psychosomatic illness, mild to moderate mental and physical handicap, spasticity disorder, and Parkinson's. Nitrous oxide also is indicated when certain complicated dental procedures are planned. For example, for surgical removal of impacted tooth, or for orthodontic extraction, particularly in patients with limited previous dental care. There are some contraindications for the use of nitrous oxide sedation. First is the psychosocial contraindication. If the patient has to be willing and cooperative. A failure to consent for treatment is an absolute contraindication to the provision of care under nitrous oxide sedation. Nitrous oxide sedation is contraindicated for unaccompanied patient. A responsible adult uh, who will remain with the patient until their recovery is complete must accompany patient who are receiving sedation. Without this responsible adult, nitrous oxide is contraindicated. Inhalational sedation is also contraindicated in severe psychological or psychiatric problem. Patients suffering from delusional states such as psychosis or schizophrenia are notoriously difficult and unpredictable in their response to sedation. And nitrous oxide sedation is also contraindicated in thyroid dysfunction. Individuals who suffer from hypothyroidism are significantly more susceptible to the effect of central nervous system depression drugs. So sedation should be avoided. Mm, Nitrous oxide sedation should be given cautiously in pregnancy and lactation. Yeah, it is wise to carry out as little treatment as possible for pregnant patients. Almost any drug that is given to the mother will cross the placenta and enter the fetal circulation. So the use of sedation during pregnancy should be restricted to the absolute minimum. Inhalation sedation should be avoided during the first 3 months of pregnancy when there is the greatest risk of damage to the fetus. Midazolam can be used during the first 6 months of pregnancy if required. There is evidence that intravenous midazolam can cause hypotonia in the older fetus, and therefore it should not be used during the last 3 months of. Nitrous oxide inhalation is also contraindicated in a blocked nasal airway. A blocked nasal airway is a specific contraindication for the use of nitrous oxide sedation. Because it is important to remember that inhalation sedation will not work when a patient cannot breathe. Okay, the next conscious sedation technique is intravenous. Intravenous sedation is the fastest mode of action of the drug, and and hand, heart, and brain circulation is completed in approximately 20 to 25 seconds. So very fast. The most important advantage of IV administration is that the drug can be titrated. So this reduces the risk of respiratory depression. Another advantage of titration is that it allows the desired sedation level to be achieved according to the patient and the type of treatment plan, and the risk of insufficient or overdose medication is low. And the duration of reversal of the effect of IV administration, it is short compared with oral, rectal, intranasal, intramuscular method, but the reversal effect is longer compared with nitrous oxide or oxygen inhalation. So IV sedation is the technique of choice for most adult dental patients requiring conscious sedation. It produces a predictable and reliable pharmacological effect. So the intravenous sedation is more potent and quicker acting than inhalation or oral sedation, and is particularly effective for very anxious or phobic dental patient and for difficult surgical procedure. Intravenous sedation produces true pharmacological sedation rather than the psychopharmacological sedation that is achieved with inhalation technique. So in intravenous sedation technique, the dentist need to be well trained with the insertion of the granula. So here you can see a IV cannula has been introduced into the vascular network. Then the intravenous sedative drug can be introduced, patient gets sedated, then it is easy for the clinician to perform their clinical procedure. Appropriate monitoring equipment should be available. So it is essential to monitor the patient's clinical condition during the sedation. So the following equipment is required: pulse oximeter, manual or automatic speak more manometer. Pulse oximeter is mandatory to measure oxygen saturation and heart rate throughout the sedation procedure. The speak more manometer to monitor baseline blood pressure before sedation at appropriate intervals during sedation and prior to the patient being discharged. Also, we need to prepare for emergency equipment and drugs. So appropriate emergency equipment and drug must be available in the clinic. And the last is the recovery facility. So ideally, there should be a separate recovery area where the patient can sit quietly and privately following sedation. A pulse oximeter and a blood pressure monitor must be available, as well as oxygen and suction apparatus. So IV sedation is indicated for moderate to severe dental anxiety, for traumatic surgical procedure, for gag reflex and swallow reflex, also indicated in severe gag reflex and swallow reflex. Yeah. Is also indicated in mild medical condition which may be aggravated by the stress of dental treatment, for example, in mild hypertension or asthma. IV sedation is also indicated in mild intellectual or physical disability, for example, mild learning disability or cerebral. IV indication is IV sedation is contraindicated in patient with history of allergy to benzodiazepine, in patient with impaired renal or hepatic system, in pregnancy and breastfeeding, in severe psychiatric disease, and also contraindicated in drug dependency patients. So the drug of choice for intravenous sedation. Intravenous sedation agent should not only have the ability to depress the central nervous system, but also to produce a state of conscious sedation. And they should also have a margin of safety wide enough to render the unintended loss of consciousness unlikely. So the modern IV sedation technique depend almost exclusively on the benzodiazepine. So midazolam, and diazepam are the suitable IV sedative. The clinical effect of sedation with intravenous midazolam. Conscious sedation with acute detachment, meaning lack of awareness of one's surrounding, for a period of 20 to 30 minutes after the intravenous administration, followed by a period of relaxation which may last for a further hour or more. Intravenous midazolam can also cause anterograde amnesia, that is loss of memory following administration of the drug. It will also cause muscle relaxation, especially very useful for those with cerebral palsy. It has anticonvulsion action and slight cardiovascular and respiratory. So the advantage with midazolam, there's reasonably wide margin of safety between the endpoint of sedation and loss of consciousness or anesthesia. Okay, so there is a satisfactory level of sedation which can be attained pharmacologically rather than psychologically. Recovery occurs within a reasonable period, and the patient can usually be discharged home less than 2 hours following completion of treatment. Alright, so next we will look at dissociative anesthesia. It is a form of anesthesia characterized by catalepsy, loss of voluntary motion, catatonia, which is the inability to move, speak, or respond to stimulus. Also has analgesia and amnesia. So dissociative anesthesia is a form of anesthesia characterized by catalepsy, catatonia, analgesia, and amnesia. It does not necessarily involve loss of consciousness and thus does not always imply a state of general anesthesia. Dissociative anesthetic probably produce this state by interfering with the transmission of incoming sensory signals to the cerebral cortex and by interfering with communication between different parts of the central nervous system. The common type of dissociative anesthetic agent that being used are pencyclidine, ketamine, dextrometropan, and nitrous oxide. Dissociative agents are a class of psychedelic drug. This class of drug is characterized by distorted sensory perception and feelings of disconnection or detachment from the environment and self. They act as an antagonist of amino acid glutamate at NMDA glutamate type receptor and interfere with neuronal transport of 5-HT, dopamine, and noradrenaline in central nervous system. At anesthetic dose, no significant effect on respiration, increase in blood pressure and heart rate due to sympathetic stimulation. So dissociative agent affect perception of pain, response to environmental stimuli. It affect memory and paralysis of movement without apparent loss of consciousness. So patient appear to be awake but actually is unconsciousness. So those dissociative effect that can be produced involve feelings of drowsiness, slow ineffective breathing, respiratory depression, pain relief, there's increased heart rate, anesthesia and amnesia, and loss of muscle control as well as cognitive and memory impairment. Okay, the last few slides will be looking at the pharmacology of drug used for conscious. The first drug, the first agent is nitrous oxide. It is a mixture of nitrous oxide and oxygen, which has been used as a sedative. Nitrous oxide is a colorless gas used as an inhalational anesthetic agent. It is an anxiolytic or analgesic agent that causes central nervous system depression and varying degree of muscle relaxation and euphoria with hardly any effect on the respiratory system. The analgesic effect of nitrous oxide is initiated by the neuronal release of endogenous opioid peptides with activation of opioid receptors and descending gamma aminobutyric acid and noradrenergic pathway that modulate nociceptive processing at the spinal level. Anxiolytic effect involve the activation of GABA receptor through benzodiazepine binding site. The anesthetic effect of nitrous oxide is due to the inhibition of N-methyl D-aspartate NMDA glutamate receptor, thus removing its excitatory influence in the nervous system. The nitrous oxide oxygen delivery system are manufactured with oxygen fail-safe devices that stop the flow of nitrous oxide when flow of oxygen is stopped. So the safety mechanism ensure delivery of at least 30% of oxygen in all situations. Nitrous oxide has a low tissue solubility and high minimum alveolar concentration, which enables rapid onset of action coupled with a rapid recovery. So this ensures a controlled sedation and quick return to normal activities. It is very safe as the patient remains awake and responsive and reflexes are retained. And it is important to remember that the use of nitrous oxide is contraindicated in patients with common cold, porphyria, and COPD. The second sedative agent is midazolam. Midazolam is a benzodiazepine. The advantage of midazolam include rapid sedation, minimal sedation, complete amnesia of the procedure. It has anti-convulsion properties and very little pain on injection. The risk of midazolam injection include lack of analgesic effect and possible hypotension and respiratory depression. The next sedative agent is fentanyl. Fentanyl is an opioid. The advantage of fentanyl include rapid and short-acting sedation. It provides analgesia and increase in pain threshold. It has minimal cardiovascular depression and it suppresses calf reflexes. The risk with fentanyl, it can cause chest wall rigidity. It can cause respiratory depression or apnea. It can cause hypotension, uneasiness or dysphoria. It can result in nausea and vomiting, and it can cause EEG changes. The next sedative drug is ketamine. Ketamine is a dissociative anesthetic. The advantage of ketamine include rapid onset and very short duration of effects. So it is consistent. It provides a consistent state of sedation. Ketamine has a lack of respiratory depression and lack of effects on laryngeal and pharyngeal reflexes. The risk with ketamine includes patient may not be able to speak or respond purposefully. Patient may have delirium and hallucination in patient older than 50 years of age. Ketamine can cause excessive bronchial secretion and salivation. Ketamine also can cause hypertension and tachycardia, and ketamine also can cause increase in intracranial. Propofol is the next sedative agent. Propofol is a hypnotic sedative agent. Often, an anesthesiologist is required during the administration of propofol and monitor during the administration of propofol. So we need anesthetist on our side during the administration of propofol. The advantage of propofol include rapid onset of deep sedation and ultra short duration of effect. It is useful for initiating sedation. And propofol has anticonvulsant property. Risk factor with the introduction of propofol: it can cause burning, stinging, and pain with injection. It has lack of analgesic property. It can cause respiratory depression and apnea, and it can have a cardiovascular depression and hypertension. So with that, I conclude my lecture today. Thank you for your kind attention.